So Jen, I want to send you home today with some instructions of things that you can do to go ahead and keep your joints and your muscles comfortable after your procedure today. And one of those, of course, is your QuickSplint that we just made together. And I did promise you that everything was going to get written down for you, so I'm going to give you these pieces of paper. So one of those is, it's just some instructions for actually wearing your QuickSplint. So for this very first week after your appointment, what I'd like you to do is go ahead and wear that every night when you sleep, all night long, but I also want you to wear it during the daytime. So you're going to take it out to eat, and if you need to take it out, you know, to talk or to do something social, feel free to do that, but try to keep it in as much as possible, okay? I'm actually going to get to see you at the end of this week. I'd like to have a 1-week appointment where we have that as a post-op, and you and I can get back together so I can evaluate how you're doing. But in the second week, we're going to have you transition to just wearing that at night, so you're not going to wear it during the daytime anymore, okay? And if you'll do me the kindness of bringing your QuickSplint with you when you come back for your follow-up appointment, okay? So that's kind of one piece of that. I'm also going to give you these instructions, and there's some exercises that you can do. What we want to really do, make sure, is that we keep these muscles moving. It'll actually really help to increase the comfort of those muscles, as well as how wide you can open. Help a little with being able to help in your mouth as wide as you want to eat anything you want and to talk. And they're really simple to do. Okay, so I'm going to give you that as well. And I'm going to give you this last piece of paper to take home with you. And you actually know a lot of these things. You're actually doing a lot of these things already. You've figured out on your own. One of those would be to use medications that are anti-inflammatory, like Advil, which you're using over the counter. You can also substitute for other over-the-counter brands, but you do want to make sure that they're anti-inflammatory, okay? And so particularly in the Advils, the Aleve, the ibuprofens, the Tylenol type of medications aren't going to do this, okay? We're going to give you some instructions where you can actually alternate applying some moist heat as well as some cold packs, okay? And that can be really good as it integrates with your little exercises that we just gave you. I actually would say, even though you told me that you don't really think you have more trouble chewing certain foods, that foods that are really hard and sticky or very tough to chew actually are kind of overworking both your joints and your muscles. So we're going to ask that you actually try to avoid to eat things. So like a classic example of that might be a bagel, or a really tough steak, or things like that require a lot of effort to chew. So I'm going to ask you to be kind of conscious of that for this little bit after our appointment today, okay? And then there's a lot of really good additional things that you can look at. You know, with grinding and clenching your teeth, oftentimes that happens and you're not even aware that it happens. But if you do catch yourself doing that, it's great to sort of go, okay, open your teeth. I will actually tell you that one of the things I have my patients do is actually try to set like a 10 or 15 minute reminder. Lots of ways to do that. You can buy a dollar store kitchen timer. You can set it on your iPhone or whatever type of device you have. You know, I can do it where I set it on my device I wear on my wrist. I notice you have one also, right? So some way to remind yourself about every 10 to 15 minutes to just check in and say, where are my teeth? And if your teeth are together, just pop them open again. Part of why that's important is, believe it or not, after a couple of days, you'll actually catch yourself when you're clenching your teeth, where before you might not have. It might have been a more subconscious habit. So it's good kind of feedback management training to decrease the amount of time that your teeth are together. And especially during times that you know that you might have your teeth together. You mentioned studying earlier when we were talking. I know that you had told me that you do a lot of exercising. You might actually clench your teeth when you're exercising or running. So those are all good times to have your QuickSplint in and to be thinking about that. You know, I know that getting a good night's sleep is important to you, avoiding caffeinated beverages. So I'm going to send this home with you so you can sort of read through this. And the more of these things that you can incorporate, the better things will be. Okay?
Okay.
So what questions do you have about any of this today?
I think that covered it.
Awesome. So what I'm going to do is, on your way out, we're going to have Donna help get you an appointment in about a week, and we'll do your follow-up visit, and we'll check back in and see how you're doing.